Hey everyone, I figured I might do a quick post-op video. I had a slap tear repair on my left shoulder um, now 9 days ago. I'm coming up on that 9-day mark here in a few hours. I figured I might just give you guys a little bit of tips and advice for what I've experienced. I'm also a pharmacist, so I know a little bit about medication. However, I still experienced some pretty harsh effects from from the medication. So I just want to give you guys a little bit of insight on that. Um, the surgery went fine. Most orthopedic surgeons that are shoulder specialists know what they're doing. That's their business. The importance of keeping it immobile is a big thing. So you'll be in like something like this, an immobilizer sling. It has this padding here. Really, the whole thing with this is just get comfortable and try not to move it. I was stressing out a little bit. I talked to the nurse practitioner of my surgeon when I was like, hey, I think I did something, and it caused some pain in there. Should I be worried? She said, well, don't be worried or anything, but try not to make it a habit of doing things like that are going to cause a lot of pushing and pulling, because then that will cause the healing to be prolonged. So I would rather just get it one and done, not have to go through this whole process again, because it's been a roller coaster ride and it's only been 9 days. So I'll start off with the day of the surgery. I mean, you basically just go in there. They tell you everything. They give you your nerve block, your meds, and you're good to go. On the way out, basically everything from here down all the way to your hand is numb. You probably have already learned that from other videos if you've been watching some of these. After that, they really emphasized with me, and again, I'm a pharmacist, so maybe they forgot to tell me about, hey, if you start to get some side effects, like, don't take any or whatever, but maybe they thought because I was a pharmacist that they didn't need to do that. Well, they did, because I definitely got some side effects, but, taking the opioids pretty regularly for the first, I would say 3 to 4 days is what I did, and I took my my ibuprofen or whatever type of anti-inflammatory agent they give you. Always make sure to take that one with food, because it can upset your stomach. And meds before food, always, so that way the med gets working and it's not sitting on top of your food. Stay hydrated. That's one of my first tips. Stay hydrated the whole way. Make sure you're eating a lot of fruits and vegetables, a lot of fiber to keep you regulated, because you don't want to get backed up. And that leads me to my first encounter. So about day 3, day 4, I had a smaller bowel movement, but it wasn't like what it should have been based on how much food I had been eating. So I was like, okay, something to look for. So another day went by, nothing. So then I started to realize, okay, I'm probably developing opioid-induced constipation. And keep in mind, I'm taking half the tramadol that they recommended. If I don't take the tramadol, I'm taking half of the Percocet they recommend. I'm also taking half of the ibuprofen that they prescribed, right? Instead of 800, I'm doing 400. And again, that's just because of my knowledge of these medications. You don't want to really take the prescribed dose if you don't have to. Now, if you have to, that's a different story. But if you don't have to, then try not to, because then that leads me into the side effects, okay? So the opioid-induced constipation is definitely a thing. If you are going to be regularly taking the opioids, I would recommend just take a stool softener, especially if your fruit and vegetable intake isn't that great. if you're not drinking juice, if you're not drinking smoothies, things like that. All right. Something like a docusate plus a senna. Typically, docusate is just taken like once a day, like in the morning with your breakfast, and then the docusate senna or Docalax, you can take that as needed for severe constipation. So that was the first thing, and all the side effects seemed to happen at once. I also started to develop a mouth ulcer, which I am susceptible to develop because whenever I get stressed out, I always get these. But you can see in there, it's pretty nasty. It got to the point where it was bleeding. So I guess you could call that an ulcer at that point. But no matter how much water I drank, no matter how hydrated my lips were, no matter, the normal canker sore protocols, gurgling salt water, whatever you do, if you get those, it wasn't working. Every ounce of water that I was taking was immediately being sucked into my bloodstream, or it was just the effect of the NSAIDs. And that's where this next tip is definitely going to be important. All right. If you start to develop any mouth ulcers or any dryness of mouth, take a step back, take a break or a holiday off of your NSAID. All right. Because you don't want it to go into this. This was waking me up every 2 hours at night. I needed to take a sip of water. My cup was on the other side of my bed, so I had to get up, which is a pain with this thing. Bend over, go over there, get it. And again, you're drinking all this water, you're peeing, so you're getting up, you're going, to hydrate your mouth. You're getting up, you're going to pee. It's not a fun thing. All right. So if you can avoid that, I would recommend, if you start to get some warning signs of a dry mouth, or you start to get some mucositis, some inflammation, some bubbles, some ulcers develop, definitely take some holidays off of those NSAIDs. And I know anti-inflammatories work great for pain and stuff, but again, if you're not really having a lot of pain there, you don't really need to take it. All right. At least in my opinion, I would rather have a little bit of pain here as opposed to developing all of these ulcers and having my sleep destroyed, and then having to go on basically a fruit fast the next day. All right. Because I couldn't get my bowels moving and I couldn't hydrate my mouth well enough. So I had to basically just eat watermelon the whole next day, which with one arm is not fun to cut. If you don't have somebody taking care of you, I had to put 22 full-length stabs with a long blade to get that watermelon half, and then I basically just ate it with a spoon. And that was all I ate basically that whole day, outside of some organic Evolution cold-pressed apple juice, which was really good getting the bowels moving. So try to stay ahead of those types of things. If you start to develop, the mucositis, if you have to take your NSAID and you're gonna have all this pain, just get some artificial saliva. Biotin works well from what I've heard. I haven't taken it personally. And then watermelon. Watermelon is really good. It's not acidic, so it doesn't irritate your mouth. But it really does hydrate you, and it kind of counteracts that from the NSAIDs. So those are the two things that I just wanted to send out to you guys who may be watching YouTubes for just some support, because I know that's how I was when I was, a couple of days ago. I was like, somebody help me, somebody give me some advice, and obviously that's what your doctor is there for. Your doctor's assistant or nurse practitioner, physical physician's assistant, PA. That's what they're there for. But again, these are two things that if you can avoid them, your recovery will be very smooth. Because other than that, it's basically just keep your arm in a stationary position, and do things that you want to do, like right now I'm recording this video, right? Read a book, write a book, draw, read magazines, watch YouTube, watch Netflix, whatever it may be. But anyway, hope that helps. And if you have any questions or want to comment on anything that I've said, feel free to leave it in the comments below. Other than that, stay healthy. Take care.